Okay, good morning, everyone, and good afternoon if you're in a different time zone. We'd like to welcome you to this healthcare webinar hosted by IT News. If you give me a moment, I'd just like to share my screen with you. Great. So I'm just here as the moderator. My name is Lindsay Stewart Isherwood. I am from the Department of Molecular Medicine and Hematology at Wits University in Johannesburg. And I have the privilege of, after this introduction and a short presentation for myself, to introduce to you two colleagues from Zebra Technologies. That's Christopher Ree and Wayne Miller. They will be our main event for this morning. But I thought I would just open up the session first by giving an overall agenda for the program. So first we'll start off with the opening address, which is with myself, and then we'll hand over to Zebra Technologies, where they'll present their technology called The Future of Healthcare, Patient's Journey and the Digital Twins. Then, if you don't mind, we will hold off all questions and answers until we'll answer all of your questions at the end of the session. But please feel free to type all of your questions in the comment box in the meantime, and then we'll address them towards the end of the session. So for those of you who are new to digital health and who are not in the field of digital health, I thought I would start off by giving you a definition from the World Health Organization. And digital health refers to the field of knowledge and practice associated with any aspect of adopting digital technologies to improve health. It incorporates the subdomains of e-health, medical informatics, health informatics, telemedicine, telehealth, mHealth, as well as data analytics, big data, and artificial intelligence. So there are various components of digital technologies that one can incorporate into your digital health solutions, like big data, cybersecurity, Internet of Things, 3D printing, drones, virtual reality, and all of those ticked in green are what we have as our Department of Molecular Medicine and Hematology have applied in our research. So here at Wits University, we have a specific niche that we work in, and we have a holistic approach to improve the laboratory value chain. And we work in a very collaborative spirit with different donors and suppliers and new innovators who would like to come in and do an MVP of the digital health solution. And we can help them put it into the field and do a sort of a real world scenario pilot. So our laboratory value chain and the areas we specialize are in specimen collection and monitoring. We help with bottleneck resolutions, and we deal with different specimen types and different specimen technologies, specimen collection technologies. And we work across a tiered laboratory network where there's centralized or point of care. We work with many laboratory information systems and the integration thereof. And we also bring in the healthcare worker at facilities. And we're very big at linking patients into care, using digital technologies to link patients into care. So we have a very keen interest in making sure that digital health solutions are patient-centric, and we include the resulting components, so patient resulting and how to automate that in real time, and then also include logistics. Logistics is a very big component of the laboratory value chain, making sure the road networks are optimized and tracked. So we work in a very collaborative way, like I've mentioned, with different donors and ministries of health. We've worked across Africa and Indonesia, and we've been to China as well. And we work across different diagnostic components too, right through HIV, TB, COVID-19, NCDs, and we are involved in optimizing many of these workflows. But our biggest component, we have a large research and development department with world-class scientists that are on board. And with me being a a healthcare scientist myself, I use that background to integrate it into digital technologies. So our biggest success story is Elabs. Elabs now is a digital health solution that has been scaled up in South Africa and Zambia, and is now been looking at in Nigeria and Liberia as well as Mozambique. And our Elabs global leadership team consists of our colleagues Portia Sajake, Kumbere Chikudu, we call him Casey, Mr. Casey, and my colleague Fazai Maranga as well. And it's underpinned by Professor Wendy Stevens, who heads up our Department of Molecular Medicine and Hematology. But in a nutshell, the way Elabs works is it is a digital health solution that strengthens the clinical laboratory and patient interface across the laboratory value chain. And it is an automated workflow solution that tracks the specimen and the resulting right across the value chain, across the pre-analytics, as well as the analytics, and then the post-analytics, which is resulting straight back to the healthcare worker in the facility or to the patient. And it has a central administration on a web management portal, and we are able to integrate with different legacy systems. We're also able to send out alerts of results to healthcare workers. So that means that if there is a result that needs to be actioned by a healthcare worker, that is alerted to the healthcare worker directly onto their mobile device. And it gives them the indicator that they must go out and reach that patient to bring them either back into care or to make sure that they need to come back for another test result. This technology was established in 2016. It was done through our technical expertise in or assistance in scaling up HIV viral load testing in Zambia. And we recognize these gaps. So we designed a digital tool to investigate all these gaps across the laboratory value chain in Zambia. And we used all our indicators within this tool, like specimen logistics, shipping tools, quality management systems, training, connectivity, etc. And we developed the solution from there. So we basically were just closing the gaps from what we saw in the field. We realized it was a very big gap that results were taking a very long time to get back to the facility because they were paper-based. It was taking a long time to have results actioned. There were delays in the laboratory. So this whole Elabs system gives one the visibility. I'm actually going to go down to a few slides here. Through dashboards, we are able to bring about visibility to the ministries of health and relevant in-country stakeholders to help them oversee the HIV viral load and COVID-19 programs in their countries and help them to reach the program indicators. And this is just a snapshot of our centralized data command center that is based here in Johannesburg. So we have real-time dashboards operating our data command center as well as a call center, and we use the mode of contacts are WhatsApp, SMS, and calling. So if any Elabs end user needs support, we have a centralized support system and that could help them out. And we accelerated all our experience that we used in our R&D and in the laboratory network and in digital health to actually implement COVID-19 diagnostics for our country. All our labs are connected, so we're able to map our labs. So we were also able to, through heat maps, determine and monitor our TB programs and HIV programs in our country and see how COVID-19 actually affected these programs. I actually am going to, because we're running out of time, and I'm happy to share these slides with all the delegates. But here's our partners. Like I say, we have a broad spectrum of partners that we work with. And I'm going to actually hand over to Zebra Technologies now. But as we go into the discussion, the presentation and discussions, I'd like you to think about, we're really all about optimizing patient care. So this means that we need to make sure that we have longitudinal electronic health records for our patients. But one important aspect of making sure everything is linked is we need to have a unique patient identifier. And how do we do this? Many countries have many different ways of doing this. But when we're talking about global interoperability, how do we make sure that we can link patients into health records and make sure they receive the appropriate and optimized care? So without further ado, I'd like to hand over to Christopher Ree and Wayne Miller from Zebra Technologies. Thank you.
Thanks, Lindsay. Good morning, everybody. I'll just wait for the slide to come up. Thanks all for joining our session. In the interest of time, I'm going to jump right in. First slide, please. What makes Zebra a market leader? Is it our global footprint in 50 countries or having over 3.5 billion turnover? I believe it's our investment in research and development that sets us apart from our competitors. We do thorough research to understand our customers' needs and develop, invest, and innovate in products and solutions to meet those needs on an ongoing basis. And I think that's what sets us apart. Next slide, please. Further to my point in the previous slide, we did a vision trend study with healthcare, which pointed strongly to a focus on empowering nursing and clinical staff with tools to address the increased demands, with tighter budgets, increased patient numbers, and lower resources. The three most important factors raised during this study were enabling patient care, improving staff productivity, and operational efficiencies, which is setting the trends for mobility technology adoption. Zebra meets these demands with devices that are fit for purpose, easy to clean, lightweight, and multifunctional. We focus on the enterprise market with the correct security options available to lock down the devices and created a software platform where the data that these devices capture can be put to strategic use. Next slide, please. Traditionally, Zebra was a hardware supplier. We have adopted our portfolio over the years into variants of desktop, mobile, and industrial devices to enable the visibility of the patient journey throughout the hospital, collecting data and sharing it within the electronic medical record. Further to this, Zebra has invested in a software platform that allows the creation of digital twins with the patient to enhance their experience and give visibility. We're all familiar with our digital footprints in our personal lives. When you look at a platform like Facebook, they've been doing it for years. They're tracking various information from us on our phones or on laptops or tablets, and we're not always very happy with that. However, within healthcare, it's a different positive twin. It's controlled with consent and it's to your benefit. It allows you to place information on an electronic medical record into an app, into a piece of software that allows you to track assets, locate staff, and manage inventory, be it in the operating room, the pharmacy, or at bedside. We call this platform on our devices MotionWorks. Next slide, please. When we look at the patient journey, it's a collection of interactions with various staff and departments within a hospital. Clinical teams are the center of the patient's diagnosis and treatment. Information such as what blood type, are they allergic to any medication? How often must they receive the medication? What is the current medical condition of the patient? Are some of the data to be captured at each point in the circle? It's important for this information to be stored correctly and accurately to ensure safe treatment and a positive experience for your customer, the patient. There are different interactions from admission, point of care, labs, pharmacy, administration, and discharge. There can be complex processes, the amount of data that is to be collected and stored at each point, which in turn need to be interacting with each different departments. So you'll have the administration department having to feed into the back office or into the wards. They can be complex. So the amount of data that is to be collected and stored at each point and feed into these different departments need to be safe to the patient and need to be visible, supporting the patient's journey to ensure a positive experience. Next slide, please. We cannot talk about the patient's journey without reflecting on the nurse's journey. What about the nurse's digital twin? All those interactions with the patients need to be captured to ensure that we have the right data about the right clinician with the right patient. A third of all patients require blood testing. We want to label the bloods at bedside to reduce the nurse's walk time and to make sure that they get to other functions and patients. In other words, increase productivity. Large amount of data has to be captured throughout his or her day. Why not make it quick and easy at bedside? Making sure the right medication at the right time in the correct doses are administered. Capturing that information accurately and instantly is what makes the journey easier. One device interacting with all these tasks and data all the way throughout the nurse's workday. A clinical smartphone interacting with different equipment throughout the day with different applications via an Android app. Nurses can control and take readings from various medical assets like bedside heart monitors, infusion pumps, blood pressure monitors, and the likes. Sharing complex data accurately is key and can all be done at the bedside on one device. Ultimately, the focus is the safety of the patient and eliminating the risk to them. Having a multifunction device with medical grade plastics at bedside is key. Next slide, please. Zebra designs devices to fit into the healthcare environment with medical grade plastics that allows you to clean them, very much like you would clean your hands. This has become a big focus as a result of the pandemic, as you're all aware. Why not invest in a device that has the capability and durability to be in these harsh environments for a long period of time? Devices that can interact with each other through a tap and pair function, like our smartphones pairing with mobile printers or a desktop printer at a workstation. Devices that are able to interact with medical equipment. All of this makes the healthcare worker more productive and the patient's journey positive throughout the digital twin. Next slide, please. On that note, I'm going to hand over to Wayne, who's going to talk you through our MotionWorks platform. Wayne, over to you.
Thanks, Krista. Morning, good afternoon, wherever you are. Wayne Miller from Zebra. I lead the healthcare vertical for Europe, Middle East, Africa. And I'm going to talk to you a little bit about MotionWorks. So what is MotionWorks? MotionWorks is a Zebra platform where we house location data and we house application information. So when we think about healthcare, we're talking about visualizing workflows, the digital twin. And we're familiar with this in our own personal lives. We have internet banking. For those of you with children, you can track your children using a map. Very similar principles, but healthcare is far more complex, as I'm sure we'd all agree. Lindsay mentioned about patient identities, and that's a real key starter here, is we all have an individual identity. We all have an individual medical record. Drugs react differently to different people, and Krista mentioned that about adverse drug reactions. So in essence, MotionWorks is about who, why, what, where, when. So it looks at recording activities, provides live visualizations of these activities, allows you to manage and view workflows, and uses predictive analytics to give you operational intelligence. There's also sets of management dashboards, sets of reporting in there, okay?